at now is the cranial nerve examination. Okay, so in exam, if you are asked, you just concentrate on the cranial. So in exam, you might be asked neurological examination. This patient has got this problem. Do a cranial nerve examination. The question will be very specific. So it's important that you check the question very, very carefully. Because if you don't do that, I have seen candidate who didn't read the question and then they came and they are thinking what to do. But so even if you write it down, what are the things you need to do? You get 1 minute. If you are focused and if you think clearly, you will be able to. So this is just for cranial nerve involvement, cranial nerve examination. So Jack, isn't it? Jack, have you smelled your coffee okay this morning?
Yes.
No problem with smelling. In exam, there will be 3 small like glass bottle where you will have 3 peppermint, almond and something else. But you just have to ask Jack to smell it and tell what flavor is. And the flavor is not very good. Sometimes you don't get the actual smell, but it should be okay for exam. Okay, but that is not important. Second cranial nerve. Okay, Jack, can you read what is written down here?
Yeah. Cranial nerves 1, 2, 3, 4, 6, 5, 7, 12, 8, 9, 10, 11.
Wonderful. So in exam, you will usually have Snell's chart and you will be asked to read it. You might have to keep it at 6 meter distance. Okay. And there will be a Ishihara chart for color vision. Okay. So these are the 2 important things you will be given in exam and you have to do it. The next is what is called visual field examination. So how do you check the visual field? So what is the whole concept of visual field is when I am checking Jack, I am presuming that my visual field is normal. Okay. If my visual field is not normal, I can't check Jack, because what I am doing, I will compare my visual field with your visual field. Okay. So before you start, Jack, can you see me clearly? Okay. Can you see my finger moving? Okay. Can you see my finger moving? Okay. Which side is moving? Both. Which side is moving now? Now? That's it. So what did I check here? This is not visual field examination. What did I try to check? Whether there is any evidence of visual inattention. And what do you expect in visual inattention? You will expect that somebody who has got inattention, they will be able to say when I am moving it on the left side, they will be able to say when I am moving on the right side. In other words, their visual field is intact on both sides. But when I am stimulating both sides together, they would see only in one side. Usually, it is due to the affection of the right hemisphere. So they would be able to see they won't be able to see the left side. Okay, they would still able to see the right side, but not the left side. That is visual inattention. Okay. Now for confrontation test, what we do to check the visual field. So Jack, why don't you cover the right eye with your right hand? Okay, I am covering my left eye. Now look at my eyes. Okay, and I'm going to bring my fingers from a distance. When you can start seeing it, just say yes. And you can, if it vanish anywhere, you can see it all through. Okay. So I am looking at the lateral upper quadrant or temporal upper quadrant, and this is, you can see it moving. So make sure you bring it so that you don't miss scotoma. Okay. Keep it covered. Okay. Can you see it moving now? And now? Okay. Wonderful. So all the visual field is okay. Now next thing what we will do, checking the blind spot. Keep it covered. Now just you can see the tip of this this upper half. Look at it properly. You can see this up. Okay, look at my eyes. If at any point it vanish, just let me. So this is how to examine the blind spot. Okay. So that's the one half. And then I'm not going to repeat the blind spot again, but that's the principle how we do it. But I'll show the visual field on the other eye. So Jack, can you cover the left eye with your left hand? And look at my left eye. Okay. When you can see my finger moving, just say yes. Yeah. And you can see it all through. Okay. That's what it is. All through. Now, all through. Yes. Okay. So we have checked the visual field and we have checked all the quadrant. Now I'm not doing ophthalmoscopy, and in exam you are not necessarily expected to do it. You can ask the examiner, because if you have to do ophthalmoscopy you might not be able to finish, but you would complete the examination of the second cranial nerve by doing ophthalmoscopy. Have you been taught about ophthalmoscopy? Okay, clear up to this? So that's the second cranial nerve. And next we are going to examine the third, fourth and sixth cranial nerve together. Okay, so we don't do it separately, we do it together. So Jack, just follow my finger. Just follow my finger, tip of the finger with your eyes. If you see double at any point, so these each and every word is important. Okay, follow the tip of my finger. If you see double at any point, let me know. Okay, so you go side, go up and down, and then you go on this side, up and down. You are not seeing double. And then up and down, up and down. Okay, and then you can check up and down. So what you are checking, the important things to say while you are doing the cranial nerve examination is to follow the tip of the finger with your eyeball. Okay, not to move the head. And is the second important thing to tell if it is appearing, if you are seeing double or if there is some line. Okay. While I am doing this, I am also looking for nystagmus. Okay. Remember, nystagmus is something which you don't check at the extreme gaze. It has to be slightly medial to the extreme gaze, and the movement has to be at least 3 or more to be called as nystagmus. Sometimes you can get nystagmoid movement because of fatigue, and that usually is not more than 3. Is that okay? So that's one. The other type of movement which we should check. Yeah, can you look at my finger? Now this. What is this type of movement? It's called saccades, where you are doing fast moving. Okay, because the pathway is slightly different. Whereas when we check this slowly, that is called pursuit. Okay, so these are the two types of movement you need to check. So that completes the third, fourth, sixth. But for third, there is something else, which if you do ophthalmoscopy, you will check it even in second. So what do? You check for direct light reflex, direct and consensual light reflex. So if you cannot see, if I throw the light, what's happening to? Can one of you come and tell me what's happening to Jack's eyes on right and left, both? Why don't you come? Looking very smart, don't worry. Okay, so yeah. Now look at the other eye as well when I'm doing that. So this is direct and this is consensual light reflex. So you do on both sides. Okay, I do that. And what else do you get in third nerve palsy? You can get ptosis. So when you are examining, you obviously check for ptosis. And also you will see that the eyeballs are not in alignment if it is third nerve palsy. You will have ptosis. So that completes the third, fourth and sixth cranial nerve. Now next one I'll check is the fifth cranial nerve. The important thing, as we have discussed, the fifth cranial nerve has got two components. One is the sensory component and one is the motor component. Now the sensory component, I would like you to do is for fine touch and pain and temperature, because that will cover both the pathways. It will cover the what is the equivalent to spinothalamic, and another it will cover the equivalent to the posterior column. Okay, their distribution is slightly different. So when you do that, the important thing, just listen, like Jack, I'm going to, can you feel this? This is, you shouldn't do with this, you should do with cotton ball. Okay, that's the fine touch. So you can check somewhere, you can feel it. Okay, now what you are doing, as in any neurological examination, you are comparing the normal side, the abnormal side with the normal side. So if Jack said to me that the right side is numb, I'll start with the left side. Okay, so what, just listen what I'm doing, look at it. So Jack, can you feel this touch? Are they same on both sides?
Yep.
There is no difference, that's right. This and this, same on both sides, there is no difference. Same on both sides, no difference. What did I do? I follow the three nerves, ophthalmic, maxillary and mandibular division, and I am comparing one side against the another. Where if the patient has got one side problem, if they say to you, you will follow this pattern. Is that okay? The next is obviously not, you check, can you feel the sharpness? So you do it on both sides. I'm not pricking him, okay, on both sides. And the important thing, what you should not do that. The important thing, what you should ask is, can you feel it? That's one. And second, is there any difference between the two sides? That is the key word. Okay. And next is, can you pinch your teeth? Okay. Can you open your mouth? That's right. So you are looking at the motor component of the trigeminal nerve. Now is the seventh cranial nerve. Jack, can you show me your teeth like this? Okay. Close your eyes tightly, screw it tightly. That's wonderful. Okay, that's fine. So you don't need to go on blowing it. You can do all this thing, but for exam you have to be very slick. Now, as I've said, when I'm doing the 7th, I'll do the 12th at the same time. And in fact, I'll do 9th and 10th at the same time. That will save you time. So now, Jack, can you open your mouth and wiggle your tongue side to side? Okay? So that will give you an idea about the 12th cranial nerve, whether he is able to move it. The next thing I will do, gag reflex is not, you shouldn't do it in exam. But what you do is, you can just depress the tongue a bit, but I'm not doing it. Open your mouth and say ah loud. So what are you looking at? Whether the uvula is moving up and whether the soft palate is moving equally or not. So in one go, once I started examining the face, I did the 7th, I did the 9th, 10th and 12th in one go. Okay, that will save you time. The other thing, as we discussed, if you suspect that, if you suspect that this is a lower motor type of facial nerve palsy, so for exam purpose, not as a 3rd year, 5th year, you might be given a Bell's palsy. In that case, you at least should volunteer to say that I want to check the test in the anterior 2/3 of the tongue. Okay, I will check for hyperacusis. Okay, on the right side, if the right facial droop on the right side, and lacrimal test, that is very difficult. So at least you need to do these 2 tests. That will at least examiner will understand that you are thinking in the correct line. Okay. The next thing is what we are left with. You can do Weber's and Rinne's test, or you can you hear it? What about now? And they are equal. Yes, okay. And you know the Weber and the Rinne's test. So I'll just demonstrate the Rinne's test first. Can you hear it? Now you put it in the mastoid. When it stops, let me know. Can you hear it now? So normally air conduction is more than the bone conduction. Okay, and it is normal. You do it on both sides, and the Weber test. Can you hear it equally on both sides? So if there is one problem, it will lateralize. Okay. So that's all for the cranial nerve examination. Very simple. How long did it take? I was explaining, but if you do in that state where you do first cranial nerve is very easy, second cranial nerve you have to remember all the steps, and if the way I did it, you can easily do in 7 minutes, even ophthalmoscopy. Okay. Then third, fourth, sixth, you just check the movement. Important thing is to make sure what you are asking, whether you are seeing double or there is blurring of vision. Fifth cranial nerve, while you are checking the sensation, make sure that you say that whether if there is any difference, whether you can feel it first of all, and second is whether there is any difference between these two sides. And then you are including, when you are doing 7th, you are including 7, 9, 10th and 12th in one go. So you saw the muscles of facial expression. You look at the movement of the uvula so that we assess the 9th and 10th, and then you looked at the movement of the tongue, which covered 12. And then I didn't do the 11th cranial nerve. How do you check 11th cranial nerve? Can you shrug your shoulder, and can you move your head and move your head? So when you are moving the head on the right side, you are looking at the sternocleidomastoid on the opposite side. And you can do it, can you push it down? You can check it both in one go. Okay, so that's conclude our cranial nerve examination. Okay. Clear? You'll be able to do it now fluently? Don't have much time, but let's do the examination of the for the upper limb. Can you just take off your? So important thing, even in exam, that is important. You need to expose the patient because for inspection. Okay. So what are the things you look in inspection?
Muscle wasting.
Muscle wasting.
Equal bulk.
Equal bulk. Okay, you look from the front, and also you look from the back to look at if there is any abnormality in the scapula, whether there is winging of scapula, whether there is any abnormality in the spine, that will become apparent. So mainly we are looking for symmetry or any loss of bulk or any abnormal movement like fasciculation, etc. Okay, so that's the inspection part, or any scar or any rash which can have some implication in neurological examination. Is that clear? So next is, what do you do? Next is the tone of the muscles. Okay, how do you examine tone? The most important thing about what is tone, can anybody tell what is tone?
Is it just like the resistance of the muscles?
Resistance of the resistance of the muscles in passive state, not in active state, in passive state. So the important thing about checking tone is to make sure that the limb is completely relaxed. Okay, if you are tightening it up, you can't check tone properly. So for example, just relax, just go back and make sure that it is completely relaxed. So you do support the limb and check it around the elbow, around the wrist. Okay, so that's the upper limb, and same with on this side. So if this is the abnormal side, you do it second. You do the normal side first and then compare it. And always the important thing about tone, make sure that it's completely relaxed. So make sure that the limb is properly supported. Okay. So next is power. Okay. So to do the power, first of all, you can have a gross idea by doing pronated drift. So Jack, can you keep your hands up like this? For pronated drift, this is one of the very sensitive tests where you keep it up, palm facing up. So it is, you are keeping the arm in supination, and you are looking for subtle pronated drift. Okay, that is much more sensitive than drifting of the arm altogether. Okay, so you look for pronator drift. Normally you should give around 10 seconds to see if there is any pronator drift. This 10 seconds is useful because this will usually give you a clue which side is weak. Okay, then you can concentrate better. Okay, that's fine. So now next can you make a wing like this? Okay, so I'll push it down, just resist, and now push my hand down. So you are checking for the around the shoulder joint. Now can you bring your hand towards you? Now push it back. So you are looking at flexors around the elbow and extensor around the elbow. Okay. Now can keep it up. Can you cock it up? Down. Make a wrist. And cock it up and down. Same. Cock it up and down. Make a fist. Cock it up and down. That's wonderful. The other thing, you need to check for the grip strength. Okay. Can you squeeze my fingers tightly? Pull me towards you. Okay. So you are checking for the grip strength. Now there are small muscles of the hand you can do as well. So what are the common small muscles of hand you need to do? Can you spread your finger and don't let me? Okay. So that's one. Second is, can you try to move your thumb up and don't let me? So I'm doing that. Can you do like this? No, this touch this, and I'm seeing whether he is able to do that. So these are the common small muscles of the hand. First check the grip strength and then some specific what I showed. That is more than enough. So abduction, you can do this abduction of the thumb, and also you can do the opponents. Okay, that will cover all the motor part. Okay. The next is, where is the tendon? So again, while you are doing the reflex, the most important thing, the limb has to be completely relaxed. Okay, and you are comparing one against another. We thought that the left side will think it's the abnormal side. So what we are going to do, check reflex in 3 important reflex: biceps, triceps, and brachioradialis. When you are doing the reflex, first of all, feel the tendon. Okay, feel the tendon, and then you see. Okay, the same with triceps. Feel the tendon, and then just hit. Can you see that it's extending? And same with brachioradialis. You feel the tendon. See that? Very nice, normal reflex. Okay, the same. Okay, you feel it, and then the same with the just. It has to be relaxed but slightly stretched. Okay, very good, and then the same. Okay. So these are the 3 important reflex. If you don't elicit any reflex, what are the things you can do? You can ask for reinforcement, clenching the teeth, and doing this. Okay, clear?
Yeah.
What else do you need to do? From motor part, you need to check for coordination. Okay, so Jack, touch my finger and then touch your nose quickly. Okay, what you don't do, I made a mistake. When you are doing it, just do it, look for the speed. The important thing is you keep the hand at a distance so that he has to reach it, and make sure it is in such a position he has to do pronation and supination. These are the 2 most important things you should do. You don't have to move it along. Okay, that is not, that doesn't give any more information. While he is doing it, what I am looking for, the speed, fluency, and whether it is touching the target slickly. Okay, if it is pass pointing, it will move away. Okay, and do the other side. So you keep it just away so that he has to reach for it. He doesn't get it easily, and at the same time he is doing pronation and supination to reach the target. So these are the 2 things you need to make sure. Okay. So now we will check for dysdiadokinesis. So can you do like this? Yeah. With the left hand. Now, that's fine. Wonderful. So that completes the motor part. Is there anything you want to add? So we started with the pronator drift, and then we went from the shoulder, around elbow, around the wrist, and some small muscles. But remember, don't forget to do the grip strength. Okay, that will give you a gross idea whether the small muscles are weak or not. Okay, and then we did the reflex. You need to do 3 reflex: biceps, triceps, and supinator, or it's also called brachioradialis reflex. So these are the reflex, and then you check for coordination. Okay, clear? And next is the sensory examination. For sensory, as I told you, you have to do 2 pathways. One is the posterior column, and another is the spinothalamic tract. So for the posterior column, you will do the fine touch, and also we will do the vibration sense and the joint position sense. And for the lateral column, you do the pin tray. Okay. The important thing about the sensory examination, you follow 2 patterns. One is follow the dermatome. Okay. And second, you just check whether there is any loss of sensation going upward from the tip. Okay, so these are the 2 patterns which you need to do in exam. So if you look at the dermatome, so first of all, I'm going for the sharp touch. So can you feel the sharpness of the pin? Okay. So what are the dermatome I'm going to check? This is C4. Can you feel the sharp? Can you say sharp if you feel it? Are they equal on both sides? That's right. So you have to tell that. Okay. Now C5. Equal on both sides. Now you just keep your hand. It will be easier to. So C4, C5, and then C6. Same on both sides. And then you do C7. Sorry, C7 is the C6. So C4, C5, C6. Okay, and C7 is the middle finger. Okay, compare it. And then C8. Okay, and then T1, and then T2. Is that clear? So follow the dermatome. That's one. And second, you just compare. Can you feel it? The same on both sides. If they are same, you don't need to go. But if there is a problem, you go up until you have found that they are equal on both sides. Is that clear? This exactly the same way you do for the fine touch. So can you feel the fine touch and follow the dermatome? I'm not showing the whole thing again. Okay. And the next is the tuning fork. So you're looking for the vibration sense. When you're doing the vibration sense, you obviously don't have to follow the dermatome. What you look for is the bony prominence. Go from the distal to the proximal. But if the distals are normal, you don't have to go proximally. If the distals are abnormal, then you go backward. So for example, I found a bony prominence here. Can you feel the vibration? Yeah, that's right. And this? Are they equal on both sides? That's fine. So if you can't feel, then I'll move upward. Otherwise, I don't need to. Okay? So that's the vibration sense and the joint position sense. So we'll start from here. So yeah, close your eyes. This is up and this is down. Okay? Is it up or down?
Down.
Okay? Is it up or down? So the important thing is don't press your finger this way on the sideways. Okay? And then you move some and then, but first of all give the clue which is up and which is down. The same on this side. And if somebody cannot feel there, you go upward. Okay, so you go to the distal to proximal to probably wrist, and then you go up. If somebody cannot feel it, is that okay? So is there anything else in sensory? That's
Temperature. Temperature.
Temperature you are not expected to do. As I said, like these are the 3 things you are expected to do in examination, and that's why I have focused. So you need to do the fine touch, which won't be this one, which would be cotton balls, which will be there, and then the pin, prick and the vibration sense and joint position sense. Okay. Next, we will do the lower limb examination. Again, for lower limb, it is a good idea to do one thing. First of all, ask the patient to walk. That will give you a lot of clue. If the patient say that they can't, then that will also help you to identify where the weakness. So, Jack, can you walk a few steps for me? So, what are you, Jack, just wait. What are you looking when he is walking? Whether he is walking with symmetric foot, whether there is arm swing, whether there is any foot drop, all these things you are looking. And then you look from the front and then go from the back to look for any evidence of wide-based gait. Okay, whether he has got wide base, that is easily appreciated from behind. Okay, the next is I'll ask Jack to walk for 5 steps with 1 step, another like this. Okay, and this is called tandem gait. Wonderful, that's fine. And then you are, Jack, just keep your feet together. Okay, and I'll be very careful. You never know. Okay, and now close your eyes. What are you doing? You're checking for?
Perception.
Yeah, rhombic sign. Okay, so that's how you do it. So Jack's gait is completely normal. So you can come back. Obviously, next is we'll concentrate on the motor examination. You can do the gait in the beginning or towards the end, that doesn't matter. But in the beginning, if you do it, you will be able to identify if there is, in real world, it makes it easier. And the other thing is, in real world, you might miss, after doing all this thing, you forget about the gait. So you do the gait first. Okay. Next is obviously inspection. You look for exactly the same thing what we discussed in the upper motor, in the upper limb. So you look for any loss of bulk, any fasciculation. Remember, if there is loss of bulk, if you think that there is loss of bulk, how to do it objectively. So you take a bony prominence and then take a measuring tape. So for example, 5 centimeter from the bony prominence, and then check the girth and do it on the other side. That will give you a more objective way to say that there is loss of bulk or there is wasting. Okay, so that's the bulk of the muscle. You check whether there is any wasting or not. Next is again tone. Obviously, you are relaxing, your limb is completely relaxed, so you check the tone around 3 areas. So this is around, just relax, yeah, just this is checking around the hip, this is checking around the knee, okay, and this is checking around the ankle joint. Okay, so this is the tone of the limbs, and it appears normal. But if the tone is exaggerated, then you look for clonus. If the tone is normal, you don't expect clonus. Okay, so how do you check clonus? For example, this is patellar clonus, you just move it down. Okay, you take this skin fold up and then you move it down, and if there is clonus, it will start moving like this, and it's very painful. Okay, so you should take permission in a real world from the patient, because it can be quite painful. And the same with ankle joint, just flex it a bit and then you quickly do it for the clonus, and it will start moving. So that's the tone of the muscles, and then you will look for power. Power, you again divide it into around the hip. So can you lift your thigh and push it down? Okay. Again, comparing the normal with the abnormal. Now bend your knee, just pick it up, pull it towards you and push it back. That's right. And this one, pull it towards you and push it back. Wonderful. Push it back. Wonderful. That's okay. Straighten. Okay. Now cock up your foot. Push it down. Cock up your foot and push it down. You don't need to go any more detail. Sometimes they say adductor, abductor. I don't think that is much important, but can you bring your foot towards the midline and can you take it away? Towards the midline, take it away. Okay, so this include all the power examination of the lower limb. Then next important thing is the reflex. Okay, so what are the two reflex we need to do is knee jerk and ankle jerk. So again, the important thing about reflex, make sure that you are completely relaxed. You are supporting the limb properly. Supporting, just leave it under. I'll keep it. You check the tendon and hit it. The other important thing about hitting, you don't bang